Hi! In this video, I'll take you on a quick tour of what I do as an intern posted in NICU, also known as Neonatal Intensive Care Unit. I have a 13-hour duty here from 7 a.m. to 8 p.m. for 2 days. It was my first day, and honestly, I was kind of nervous. I started by washing my hands properly using the 10-step hand washing method. Then I wore a new headcap and an apron. We already had a brief session on neonatology and our duties as an intern here. So the first duty was to use a transcutaneous bilirubinometer or TCB to check the bilirubin levels of all the babies. I informed the PG about the values, and accordingly, phototherapy is given to the babies who require it. Next, I started with monitoring the patients, which is done hourly here. There were 7 patients in total, so it wasn't that hectic. Each patient has their own hand sanitizer at their cot side to be used before and after touching the patient. We usually have to touch them to check capillary refill time or for sensory stimulation. Always introduce tactile sensations slowly. Then I sat down to complete all the stat works after the morning rounds, such as writing discharge cards and sending out urgent investigation forms. Then I went for lunch break. After lunch, I started writing admission files, all while doing hourly monitoring, ABGs, sending blood samples, and doing any other work that my seniors give to me. Before the evening rounds, the seniors check the cardiac contractility of the babies. Here, my senior is teaching me about it. I always speak positive words of encouragement in soft, low tone to the babies during hourly monitoring. After completing evening round works and my part of the hourly monitoring, I was officially off duty for the day. Today morning, I walked in and noticed that there was a new admission in an incubator. I wasn't allowed to touch the baby, so I recorded everything except for CRT. I didn't want to bore you all with all the duties that I did yesterday, so today I'll only show the new things. In real time, monitoring of each patient can take around 1.5 to 3 minutes. Because for each baby, I have to check the respiratory rate properly for 1 minute. And some babies require some kind of stimulation in between. Today, there were a total of 9 patients in the NICU. And I also had to go to sncu to measure the head circumference and length of each patient. So today was a bit hectic. After evening rounds, I completed all the round works and intern pending works before signing off from NICU. Thank you for joining me.
Pause.